So briefly, the results of the BACH study by Richards and colleagues was an interesting analysis of a comparison of multiple natriuretic peptide tests for the evaluation of patients with shortness of breath. It's well recognized that BNP, N-terminal pro-BNP, and in the BACH study, mid-regional pro-ANP were useful for the diagnosis or exclusion of heart failure in patients with shortness of breath. But in this study in particular, what Professor Richards and colleagues did was they looked at patients with atrial fibrillation. Patients with atrial fibrillation are a diagnostic conundrum because AF can cause shortness of breath. And the question is whether natriuretic peptides might be helpful to identify patients with decompensated heart failure in those patients presenting with atrial fibrillation, a common combination. What the investigators found was that atrial fibrillation reduces the diagnostic accuracy of BNP and N-terminal pro-BNP, which we already knew from prior data, but they also show that it similarly affects mid-regional pro-ANP, which is produced from the atrium largely. So these results are novel and extend now the understanding of the effects of atrial fibrillation to all of the natriuretic peptide assays that we currently use for the diagnostic evaluation of patients with shortness of breath. So why do another study of biomarkers of heart failure in patients with atrial fibrillation? We already know that BNP and N-terminal pro-BNP have reduced diagnostic accuracy for decompensated heart failure in patients with atrial fibrillation. And of course, I'll remind everyone that it's not that this is a false positive. It's related to the stress of the atrial fibrillation on the cardiomyocytes, leading to an appropriate release of natriuretic peptide. But it still makes it more challenging to use these tests in patients with shortness of breath when you're trying to figure out if heart failure is a prominent issue in these patients. The hope was that mid-regional pro-ANP, being a different natriuretic peptide, might have some more accuracy in patients with atrial fibrillation, which was something that some investigators had suggested. Unfortunately, the results were, as we had shown from the PRIDE study, that mid-regional pro-ANP in the BACH study had reduced diagnostic accuracy in patients with atrial fibrillation. So it's an important extension of the knowledge of the effects of atrial fib in this setting. So what are the implications of the study by Richards and colleagues? First, clinicians need to be more careful when interpreting the results of natriuretic peptide tests in patients with atrial fibrillation. You don't want to make a false diagnosis of heart failure in a patient with a marginally elevated BNP or NT-proBNP when it's due to atrial fibrillation. So caution is advised when interpreting these values. We also know now that this effective AFib is across all natriuretic peptides, BNP, NT-proBNP, and mid-regional pro-ANP. And then lastly, a broader perspective of the natriuretic peptides in atrial fibrillation, I think, has been opened, where we must now start thinking about how and why arrhythmias like AFib cause elevations in BNP in atrial fibrillation. It might be an underlying atrial cardiomyopathy, for example, but more research is needed in this area. So to briefly summarize how biomarker studies have evolved, we have an editorial in this issue of JACC Heart Failure that specifically focuses on this exact question. We, together with Michael Felker, I speak of this concept of the tsunami of biomarker studies in heart failure that has developed over the last few years, a huge wave of studies of varying impact and quality. There's no question biomarkers have clearly affected how heart failure is evaluated and managed, both here in the United States as well as worldwide. There's no question that biomarkers will have a role in how we evaluate and manage patients with heart failure. And as these studies that are being done of biomarkers in heart failure become larger, more complicated, and more directed towards patient treatment, I do believe that we can foresee a future where personalized biomarker-guided heart failure care as well as other cardiovascular care is a very significant reality.